Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
I'm a neurologist. I'm a consultant neurologist, Dr. Kanchana Pillai from Mumbai.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So basically, the brain uses tiny electrical signals to control everything we think, feel, and do. A seizure happens when a person's brain is overloaded by an abnormal amount of electrical activity. Some doctors also describe seizure as a storm in the brain. During a seizure, a person might lose consciousness, shake or convulse or become confused, or even suddenly feel fear or panic. So that's what a seizure is.
What is epilepsy?
Epilepsy is a medical condition that causes a person to have repeated seizures. So, generally, a doctor will diagnose epilepsy if someone has at least two unprovoked seizures. Unprovoked meaning that the seizure wasn't caused by something external like a high fever or a severe infection. Epilepsy can include many different types of seizures, and while some people may have only one type of seizure, some people may have multiple seizure types.
What are the different types of seizures and do they affect people differently?
Yes, there are different types of seizures that depends on where the unusual electrical activity in the brain starts and how much of the brain is involved. We usually classify seizure as either generalized or a focal, which is also called as a partial seizure. So generalized seizures involve the whole brain, while focal seizures occur only in one specific area of the brain.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So not always. For about half of the adults with epilepsy, we may not find a specific cause. For the other half, common causes in adults can include head injuries, brain infections, and sometimes tumors also. For people over 65, even stroke and dementia can lead to having seizures and epilepsy. Genetics may also play a role, especially if there is no other identified cause. So, researchers say that certain genetic factors may make someone more likely to develop epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So symptoms can vary a lot, but some of the signs include sudden jerking, convulsing movements of the body, losing consciousness, blankly staring off into the space, becoming confused, having some repeated strange, similar stereotyped feelings again and again. Some people may, shake just in one part of the body, like the leg or the hand. And sometimes, so if you know someone who has such symptoms, then you should definitely refer them to a neurologist.
Now, let's talk about something that many people with epilepsy face stigma. Can you tell us why epilepsy is often misunderstood?
Yes, epilepsy is unfortunately often very much misunderstood. So, historically, in the olden times, people didn't even realize that epilepsy is a neurological condition, and there were myths developed around it. So, seizures can look frightening as if someone is possessed, and people may react with a lot of fear and avoidance, and that is what leads to the stigma around epilepsy.
How does this stigma affect people with epilepsy?
Yeah, unfortunately, individuals with epilepsy often face negative attitudes and discrimination from others. So this can be reflected in the reluctance to marry somebody who has epilepsy, unwillingness to employ them, aversion towards being even near them, or even discouraging their children to play with another kid who has epilepsy. So even research has shown that stigma can increase the frequency of seizures because again stress is a common trigger. That is why communities and people need to be informed and and supportive, and they should be educated.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, so triggers can vary from person to person, but common triggers include sleep, missing sleep, especially in students who skip their sleep to for their exams and all, and they may develop seizures. High stress levels, even skipping meals, or even certain types of food for some people, repeated flashing lights, fever, or any illness, and most importantly, missing the dose of a medicine. So, someone with a seizure should not miss any dose. They should be very much compliant. For women, even hormonal changes during the menstrual cycle can trigger seizures. So, maintaining a seizure diary to track these possible triggers and notice the patterns would be very useful.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Yeah, so several healthy lifestyle habits can reduce the risk of having a seizure. So I always encourage the patients to have enough sleep, as fatigue is a major trigger, and eating regular meals, balanced meals, staying active. Physical activity is generally safe for people with epilepsy, but it is good to avoid extreme sports or high risk physical activity, without discussing with your doctor. Managing stress is definitely very important, and using practical relaxation techniques, and even sometimes talking to a counselor or joining support groups can be useful.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes, of course. So at home, it is wise to clear things away that cause falls, like cords, clutter, and pad sharp corners of the tables. In the kitchen, use non-breakable dishes. Consider using a microwave when you are alone instead of the stove. And if it is feasible, even placing soft carpeting in your house can reduce the risk of injury if someone falls because of a seizure. So they're simple, but they can make some substantial difference in their lives.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yes, so just remember that with the right treatment, many people with epilepsy can manage their condition well and lead a full fledged normal life. Being aware of the triggers, practicing healthy lifestyle habits, and having a supportive environment makes a big difference. And remember that you are not alone, there's a community out there to support you.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.